From St. Louis, Missouri, this is Connect with Jade Harrell. Welcome to Connect with Jade Harrell. I am Jade Harrell, and we are kicking off this month with a powerhouse series. We are pursuing health equity and health justice with Alive and Well Communities and the Regional Health Commission, who are coming together to assure zero health disparities. And we'll take you on the tour to find out. I am so excited to be joined by the CEO of Alive and Well Communities, Jennifer Brinkman. Thank you for being here.
Thanks for having me.
What a story of how you all have become. Yeah. It feels like such a short time, but so much has happened. I mean, unprecedented work in spaces, in areas, with people, with partners we couldn't have imagined before Alive and Well existed. Take us through the story, Jen. How did this even become
Well, you've been with us on that journey. So
I'll let you tell them. Because I am overly excited, of course, which is why we're here. You must connect. But talk about the origin story of Alive and Well Communities.
Well, we started with you on the radio, talking with community as part of the Regional Health Commission, talking about health and how people were working through their own lived experience to get to good health. Mm-hmm. And in those conversations, we heard stories of trauma and resilience and triumph, but we heard about how far we have to go.
Now, Jennifer is being modest. We did hear about stories of trauma. We did see an opportunity for the toxic stress and trauma conversation. I mean, it exploded. We're talking radio, TV, print, as well as community organized meetings. So many things that happened, but Jennifer really was that secret sauce. I have to include, once you came on board and Alive and Well, STL, the show, became Alive and Well Communities, the organization. Let's talk about, now you saw an opportunity. You came in and things really started to take off.
Well, we saw the radio show having a really different impact on community than other kinds of communications and outreach than we had done before. And you could tell in the conversation that something was really resonating. And so we just spent time in community really listening about what was resonating and what did people think they needed in order to heal and be well. Mm-hmm. And naming trauma and toxic stress emerged as the thing for us to focus on.
Sure.
And so since then, we've been on this journey to help people understand how trauma and toxic stress are impacting us, that it's not what's wrong with us, but it is what's happening that is causing us to sometimes not be well.
We'll be right back. Are you enjoying the show? We'll show support for those that make it possible. Take a look. Connect with Jade Harrell is made possible by Rare Gem Productions with Tinfinity, Life and Levels Luncheon Series, and the annual Jade's Faves Birthday Celebration Extravaganza. December 8th at View 17 in Brentwood. Find, fuel, and free your frequency to live life at your greatest levels. Visit tinfinity.com, 10finity.com. Register today for the Regional Health Commission and Alive and Well Communities merger event, Health Justice, the promise of zero health disparities. Tuesday, September 26th. One event, 3 locations, simulcast, Sikeston, KC, and STL, with keynote speaker Dr. Dana Bowen Matthew, author of Just Health, Treating Structural Racism to Heal America, St. Louis, Sikeston, and KC. Register at awcommunities.org. And CKH Financial, St. Louis-based registered investment advisor firm, RIA, a financial advisor you can trust, bringing simplicity to financial planning for individuals and business owners. Make the call today to schedule a simple conversation. Call 314-477-1482. 314-477-1482. Providing clients with comprehensive financial planning with deliberate concentration on retirement and estate planning. 314-477-1482. And from Locks of Glory Salon and Spa, celebrating a grand spa reopening. Get ready for an incredible spa experience. Visit locksofglory.com for details. locksofglory.com. That's a huge question of how Alive and Well communities really took off, is looking at toxic stress and the impacts of it, as well as trauma. Now, we've done campaigns, we're several years in, but for people who may still not know, which is why we have the work to do, let's talk about a little bit the specifics of how toxic stress and trauma are impacting us that gave us the work to do in the first place.
There was a study that was done by Kaiser Permanente and the CDC in the late 90s that showed the direct correlation between adversity in childhood and outcomes in adulthood. So health outcomes, heart disease, diabetes, some forms of cancer, as well as social outcomes. We know, for example, if we've had higher incidence of adversity in childhood, we're more likely to see performance issues in the workplace. So this impacts us far and wide as a society, and many have called this the biggest public health emergency. This was before COVID, of course.
Yeah.
But that it is substantial and the impact is significant. And so that is why this focus and why we went down this path.
So we hadn't made those associations, and as I like to say, connections before, the realization that those adverse childhood experiences, stress, toxic stress, trauma,
right.
We haven't had those in the conversation before. So people may have thought something's wrong with them. Share a little bit about how the question, what has happened to you, also changed the way we approach the work. It's almost what it is in its simplest form.
Yeah, and sometimes it's as simple as when you think about a conversation with a therapist and you want to talk about what's happened that's where you are today. But we also think about these from a systems perspective. So there's a framework that we use from George Washington University called the pair of ACEs, where we think about the adverse community environments. So it's those conditions in the soil that lead to the adverse childhood experiences.
Makes sense.
So how do we change what's happened in that soil and focus on the nutrients that are in the soil and feeding those, so that we can change the adversity that we see in our communities? So that what happened for us has really become about what's in the soil, what's in our systems that's leading us to the outcomes that we have. Rather than thinking that people are broken, it's the systems that are working actually just the way they were designed, but they are producing broken outcomes.
For sure. Missing parts of the formula that actually create the solutions. In examining that, one of the surprising things that has happened is the number of partners that have come forward to not only look at systems, but their own systems and how they may have impacted, influenced, or even prompted some of the conditions that we're seeing, and their real willingness to make good on it, so to speak. And I say that because you can't unsee something you've seen.
Right.
We can't undo Michael Brown. We can't make the thing that happened go away. But what we were missing were some of those tools. Can you talk about the Alive and Well community's approach? And especially when we're going on tour with you, why also the Boot Heel and Casey?
So folks in Kansas City have been doing similar work to what we were doing in St. Louis with you. So we brought them to the table. They came to the table with us to form Alive and Well communities. They really started with the mental health community, so brought them to the table. And then we worked to bring in impacted community members to the work to really talk about how is trauma and toxic stress were impacting them and what did they need for healing.
More with the St. Louis Regional Health Commission and Alive and Well communities right after this.
For nearly a decade, Serenity Memorial Chapel has offered families compassionate services during their time of need. Serenity understands making funeral arrangements can be difficult and challenging. In your time of need, you can rest assured Serenity will provide you with affordable and high-quality service, be it cremation or traditional service. With Serenity, You will experience exceptional care for you and your loved one.
With convenient locations in Missouri and Illinois, we can now better serve you. At Serenity, elegance can be affordable.
How did you identify impacted communities? You could say, hey, we all deal with stress. We all got a little something going on. When you say specifically impacted community, how are you able to hone in and address?
We specifically decided to address anti-Black racism. That was a focus that we decided.
Wait, we're talking about health though.
Right. So join
You're
us
talking
on
about
September
the
20th. Yes.
So how, when you say impacted communities, like we are all dealing with stress. When you say impacted, how did you identify? What were those specific reasons or ways that you knew who to address?
We had been in conversation with communities we talked about before.
This is the listening you're talking about.
Yep, that led to Alive and Well communities even existing. And really began, and this was right after Michael Brown had been murdered, and really began to understand the impact of anti-Black racism, how that impacts all of us. So yes, we've all, regardless of identity, have experienced trauma or at risk of experiencing trauma, but anti-Black racism as a trauma in itself, until we were able to name, address that, and walk through that, we're not going to get to healing. And so pretty early
That's pretty bold. Like you're actually calling out not just racism, but you narrowed it and named it to anti-Black racism. That is a thing that exists and is targeted directly and impacting directly Black people, Black and brown people. Now, you didn't say Black and brown. Is there a reason there?
I think that we need to recognize people have different experiences. So again, it's not to negate certain experiences, and there's intersectional experiences that we have to recognize. But I think anti-Black racism in particular in this country and its history and its roots, until we take it out by the roots, like we're going to stay stuck. So when we look at the data of who is most impacted,
right,
and where the outcomes are the worst, especially in our state,
especially in this state,
it's Black Missourians. And that is not to say others aren't impacted. So we know that white folks living in poverty also experience poor health outcomes.
Of course. But the numbers and the research all kind of point to the same door. Can you explain the why? I've always wanted to know, well, why? If you don't have that, I understand. That'd be a lot to take on. But also in naming this, did this implicate people? And did you find this to be at all way too enormous, too systematic, too anything?
It is big.
Okay.
But when you begin to see how the dots connect, so you ask why, and that's the book we've been reading, Just Health, that we've been telling people to go read. I mean, it takes you through the why, right? When we have communities that experience disinvestment.
Yeah.
And then the investment going into the school system is less. And then people who have the means then go to find another school district that has more means, when those who are left in that district continue to have less. And then with a lesser education, less exposure to opportunity, and then ultimately health.
Right.
Or, as the book talks about, if you don't have good health, then you can, having good job with good income is difficult.
So the dots are connecting, and they can't really be considered without taking thought or consideration of those other matters and how they work. So how will you do this and make it work?
So
I believe, I do.
I do too, because
you wouldn't be doing this.
Yeah.
But we've got evidence now that it does work. And now that it's integrated and that there's more to consider and there's more dots.
Yeah,
and people are going to do this.
I think fear is the only thing that keeps us from getting there. And so we have to be able to walk in courage, to have hard conversations, to understand what's happened, and be open to hearing each other's stories, just like we did on that radio show. Oh, and so it's working with our community members and sharing what we've come to understand, and then sitting with them as they figure out what they want to do about it. So we don't have answers necessarily, but we want to sit with people to develop what they need to get to healing and well-being in their communities.
There's a saying in the work that you have, you can't heal what you don't reveal. And if we're getting to that root cause and being able to uplift that, remove it, not uplift it in a good way, we do need to name it, identify it, reveal it. As we're looking at where these things unfold and where people are telling us, hey, this is where I'm hurting. What do you do for those that don't quite know? And is this why our outreach efforts are what they are?
And that's why all the partnerships are so important, because everyone has their own path to healing. For some, it might be their church, and that might be where they find their healing. For others, we'll hear about meditation and yoga and things like that, and that works for some people, but not for everybody.
Sure.
So I think recognizing and creating a community where all of those options for healing are available to people, for people to opt into.
That's powerful. Options for healing, not the whole, I don't have a choice, they told me to do, I gotta do a thing.
Right.
Some options for healing that you get to select that best suit yourself. So, Alive and Well Communities, powerhouse, got out here swinging, hitting different regions. KC, Boot Hill. Why are you now coming back to, so to speak, or joining forces with the Regional Health Commission?
Well, we're really excited to be doing that because their mission of zero health disparities aligns with the work we've been doing.
Indeed it does.
And we can't get to zero health disparities unless we can heal from the trauma that's occurred. And so we don't think we can do it in these silos, and we need to do it together. We also don't get there because we know policy impacts health.
Right.
And so it can perpetuate the different outcomes,
Indeed.
or it can close that gap.
Yeah.
And to do policy work, we need to do that in solidarity with our urban partners in Kansas City, and also with our rural partners in the Boot Heel. So doing that with the Health Commission and with the authority that they have and bring to the table, we have just more opportunity to get there.
For sure. So you sound like you're optimistic. There's strength in your partnership. There's great advantages to what each organization brings to the table. For you personally, how do you envision our region as this work succeeds?
So I envision our state, so bigger than our region, as having where everyone truly has the opportunity to reach their version of wellness and well-being. And that is an opportunity that our children want to stay here.
Right.
And live here.
Right.
And raise their families here.
Exactly.
So we can be grandma here.
Okay.
We don't have to go somewhere else.
Exactly. I want that opportunity, and it sounds like a beautiful way to be that would benefit well beyond health, but the health of our nation, the health of our planet. So while that is further along the road, the most immediate benefits we'll see are what? What's something like, as soon as that dotted line is signed, I mean, we're here in the headquarters now, beautiful office. What are some of the most immediate things that we'll see happen or notice?
Our community members, I think, will begin to see us out in community more. We'll have resource to be on the ground with folks, to create spaces, to have these conversations, and to be the support and the catalyst to bring the solutions forward. So I think that's what folks are going to see immediately.
I love it. Well, this is something I haven't had a chance to ask you in years. I have to brace myself. Jennifer Brinkman.
Jade.
What does Alive and Well mean to you today?
Oh, it does mean not letting fear hold you back for when you know that you see the path and you're being guided that way. And having the support and the community around you to be able to do that. And every time I'm in community doing this work, I feel that. And that's what gives me hope and just keeps me excited and pushing forward despite the challenges.
We are excited, and your excitement is certainly contagious. There's more to come. We are spending every week to dive deep into this, not only for your awareness, but your opportunity to connect with the Regional Health Commission and Alive and Well communities. Jennifer Brinkman, it is such an honor to get to talk to you again. And I'm trying to behave myself, but it's my show, so I don't have to. But on the other formal things, I will. I am so proud of you and what you've been able to do with all of us. You've fired us up. You've given us help, hope, and direction, and friendship and sisterhood. So there is much, much more to come. You stay with us as we go all over Missouri, not just this region, but the state, and see how we might see zero health disparities. I'm Jade Harrell. Thanks for connecting. Wow. If you're as excited as I am and have learned as much as I have, don't miss the next episode of Connect with Jade Harrell. We're all over Missouri in pursuit of zero health disparities. Each week, we bring you the best of what the community has to offer and those that want to see it better. Connect with us on social media, and we want to hear your ideas. I want to know how you want to connect and what you're up to. So stick with us, and we'll see you next time.